Success Collaborative will position our state as a national leader in the crosswalk between innovation, higher education, and student success. While several states across the country have launched similar centers at the post-secondary level, ours will be the first to work with both 2- and 4-year institutions, linking campuses with businesses, community leaders, state policymakers, and national foundations. We owe the James Graham Brown Foundation a great deal of gratitude for their generous gift. It is the largest privately funded grant that CPE has ever received. The goals are ambitious. Housed at CPE, the collaborative's primary focus will center on 3 main objectives: information sharing, professional development, and assistance with research and analysis. But the ultimate goals are improving graduation rates, closing equity gaps, and enhancing student preparedness for work, areas that are crucial to meeting our state's strategic targets in higher education and ensuring that Kentuckians are prepared for meaningful civic participation and success in the job market. We know that even with the recent gains in educational attainment, college graduation rates remain significantly lower for certain groups of students. That includes first generation, low income, and underrepresented minority students, and the pandemic has only widened those gaps. But this collaborative is an opportunity to turn those trends around and implement wide-scale, lasting reforms that set the stage for a new generation of leadership in our state. We believe all Kentucky students have the right to equitable access and to higher education, and this collaborative is a tremendous step in that direction. Last but not least, we have some flooding cleanup announcements. There are grants available for up to $25,000, and they are available to 48 counties with declared states of emergency associated with the March flooding. Grants can be used for flood debris cleanup to cover the cost of collecting, transporting, and disposing of municipal solid waste resulting from the flood. Grant application packages will be emailed to eligible counties. Storm debris handling guidance and additional resources can be found on the Energy and Environment Cabinet website. Contact your local solid waste coordinator to find out about local debris disposal guidelines. The funding comes from the Kentucky Pride Fund through a $1.75 environmental remediation fee for each ton of garbage disposed of at Kentucky Municipal Solid Waste Disposal Facilities. The Kentucky Division of Waste Management administers this fund. And so for additional information, you can see that there is a number on your screen that you can call, 800-451-1954. And services are available through tomorrow, March 26th, as resources allow. And that will wrap up our good news today. So, Governor, I will turn it over to you.
All right, almost the end of good news. There was one more that I wanted to personally pass along. Today, I want to highlight a very encouraging development in Gallatin County that stands to create dozens of high-quality, high-paying jobs for Kentuckians. Nucor Tubular Products, a division of steel products manufacturer Nucor Corporation, plans to construct a $164 million tube mill and create 72 well-paying full-time jobs for Kentucky residents in that region. When I say these are well-paying jobs, I mean it. They will have average salaries topping $70,000 annually. These are the kind of significant wages that help our families and they spark future growth. These are exactly the type of opportunities that we want in the Commonwealth. Once operational, the 396,000 square foot tube mill will provide capacity to produce 250,000 tons of steel tubing annually. These products include hollow structural section tubing, mechanical steel tubing, and galvanized solar torque tubing. They will be used in construction, infrastructure, and renewable energy industries. Locating in Kentucky will position the mill near expanding solar markets in the United States, as well as regions with the largest demand for hollow structural sections tubing. Construction of the mill is currently expected to begin this summer and finish mid-year 2023. Before I go on, we have a video to share with you from our friends at Nucor.
Hi, I'm Gift Artridge. President of Sheet and Tubular Products at Nucor Corporation. What an exciting day as we get to share this announcement about our continued growth in the state of Kentucky. The announcement today of our $164 million investment to construct a new state-of-the-art tube mill on the site of our Nucor Gallatin mill will allow us to better serve our customers in the construction, infrastructure, and renewable energy markets. The project perfectly complements the growth of our Gallatin sheet mill and the approximately $650 million in expansion development on site there, as well as the $1.7 billion greenfield investment for the world's most modern plate mill currently being built in Brandenburg. With our other tube mill in Louisville, our River Metals recycling facilities throughout the state, our Harris rebar presence, and our Steel Technologies joint venture with Mitsui, this mill will mark Nucor's 17th location in the state. This new tube mill adds more responsible, stable, and sustainable jobs and will continue to leverage all the best that Nucor and Kentucky have to offer. Logistical advantages with proximity to market and customers, access to our existing mill, access to a great workforce that shares the culture and values of Nucor. And last but certainly not least, the great relationships that we have and maintain with the Commonwealth of Kentucky, the General Assembly, the Kentucky Economic Development Cabinet, and of course, Governor Andy Beshear. We are so proud to call Kentucky home and are very excited to continue to grow our team of nearly 2,000 teammates in Kentucky and over 26,000 teammates across North America. Governor Beshear, on behalf of the entire Nucor team, thank you. Thank you for making Kentucky a great place to do business and call home. We look forward to continuing to work together and building a great future together.
I want to thank GIF and all of Nucor. This is now over a couple $2 billion of investment in just the last several years. I mean, this new tube mill is going to be located near their steel mill in Gallatin County, where they recently completed phase 1 of a massive expansion, with phase 2 now underway. In addition, last year I got to congratulate the company virtually. I remember I was in quarantine on breaking ground on a 400-job, $1.7 billion new steel plate manufacturing mill in Meade County. So to Nucor, thank you, and don't stop now. There are lots more places in Kentucky. There are lots of great workers. We are ready to continue to build this relationship. All right, let's continue with good news in talking about vaccines. Let's put up table 1. As of today, we're right at 1.25 million Kentuckians that have received at least their very first shot of hope. That is more than 36% of all of our adult population, those that are eligible for it. It is really exciting. And if you look at table 2, which we'll put up, the week of March the 16th was by far our best week at vaccinating. Between the federal and the state programs, nearly 200,000 Kentuckians getting that first shot of hope. That is a pace we want to keep up. And because of that, today we are announcing 3 new sites to add to our locations across the Commonwealth. These sites are Paul B. Hall Regional Medical Center in Paintsville, Casey County Hospital in Liberty, and Jane Todd Crawford Hospital in Greensburg. This now brings our totals up to 573 total vaccination sites in Kentucky. Now, with this many vaccination sites, we are starting to see some openings. I know for so long, it was hard to get an appointment. And for so long, you'd get on the computer or get on the phone and try. We're starting to see some of these open up a little bit. So I'm going to do my best, both in social media, regular releases, and when we do our updates, to tell you some areas that have some significant or a decent number of open appointments. First, let's talk about vaccination openings we know today. Kentucky Dam Village Convention Center down in Gilbertsville has almost a couple thousand appointments that are going to be open in the next week to 2 weeks. That means right now in Western Kentucky, if you live anywhere close, you can get in pretty quickly. Here's the website, kyvax.com/KYDAM. Make sure, if you're anywhere around the area, and please, media in the area, continue to push out that these are open. You can get in and out quickly. We've heard from parts of the region that they think that more vaccine was needed, and it's there. A whole lot of it's there. We need people to take advantage of it. Second is Owensboro Regional Hospital. Again, that's owensborohealth.org/vaccine. Third, Lake Cumberland Regional Hospital. You sign up, dial this number 844-675-3390. And finally, Pikeville Medical Center continues to have openings. Let's make sure to fill them up. We are now going to make it a little bit easier online to see where in the state we believe there are openings. If you go to kycovid19.ky.gov and you look at our vaccine page, we are now going to have a link that says current vaccine openings. You can see it on the screen there. Why don't you all get on? Go, if you haven't gotten your shot of hope, and look at it and see where's closest, what you have the time to go do. But we want everybody to get vaccinated as quickly as we can. I know we had a question from a WEKU listener who is in Lincoln County, and knowing several people in 1B who are waiting for the Johnson & Johnson vaccine. Johnson & Johnson vaccine is extremely limited. And it's only been recently approved, and the company shipped out just about everything it had manufactured. If you are in 1B, please do not wait for J&J. These are three great vaccines. We need you to get the one that is available as quickly as possible. To give you an idea, I mean, we have almost a couple 100,000 Moderna and Pfizer vaccines. It's probably closer to 180, and I think we have 20,000 total J&J vaccines. If you are in 1B, you are in a category where you are likely more susceptible to this virus. We need you to go ahead and get the vaccine that you can get at the moment. If you are in Lincoln County, we had talked about Lake Cumberland Regional Hospital. They can take you now. I believe the Casey County, the Casey County Kids Clinic could also take you. Their number is you can text Casey to 270-864-2889. Those are just two examples of areas that are close that have openings. Please go ahead and get it. It's a really good sign that we are seeing a lot of demand for J&J. That is the third vaccine that's out, and there were initially some worries that people might shy away from it. So for getting to herd immunity, for getting everybody vaccinated, it is a good thing because it means when it comes in, people want to get it. But waiting for it would be a mistake. It's a mistake for you personally, and it holds us back as a state in getting where we need to go. The amounts of Johnson & Johnson are going to increase significantly over time. But right now, it is still just a very small part of what we get overall allocated to our state. Another big announcement. Starting this coming Monday, we are asking all of our vaccination clinics to open up to individuals 40 and older. This will mean everybody in 1A, 1B, and 1C. It's open for you, and now individuals 40 and up as well. That was a priority group below 1C. We're trying to thread this needle just right and to make sure that we don't open to everybody too quickly and thus frustrate folks, but also continue the demand. Now, I will say I think we are pretty close in the Commonwealth to opening to everybody, but we're going to take this next step. And remember, all of our sites are allowed to dip down into the lower priorities if that's what it takes to get 90% of what they get each week into people's arms. All right, with that, Dr. Stack is with us. He's going to provide us an update on the Eastern Kentucky nursing home that's experienced this variant, with the top line of why you want to get vaccinated and why you want to get vaccinated quickly. I don't want to steal his thunder, but those that were vaccinated are generally going to be okay, and those that weren't have faced much tougher outcomes. Dr. Stack.
Thank you. Good afternoon, Governor. Good afternoon, Kentucky. So on this update for the nursing home, to emphasize the governor's point, the message here, the message to share with the public is just how important these vaccines are and how well they work. So in this instance, again, it's still evolving, but as of today, these are the rough kind of breakdowns. About 90% of the residents at the nursing home are vaccinated, which is fantastic. We always wish it would be 100%. 90% was pretty good. About half of the staff were vaccinated. So obviously we want to keep working on that and get that elevated. We need people to choose to get vaccinated because this is really important to keep themselves safe and to keep others safe. So here's how the vaccines had an impact. For those people who were vaccinated, about 1/3 of them actually who got infected had symptoms, just 1 in 3. For the people who were not vaccinated, though, more than 85% of the people without having received a vaccine had symptoms. That's a huge difference. It's more than 2.5 times increased likelihood that you will get symptoms if you were not vaccinated in this setting. Now, if you look at hospitalizations for the people hospitalized, only 4% of the people who were vaccinated, who were residents, ended up being hospitalized, just 4%. Of the people who were not vaccinated, the residents who were not vaccinated, 19% of them ended up in the hospital. So that means for the ones who were not vaccinated, the residents of the nursing home, 1 out of 5 of them ended up in the hospital. That's a more than 5-fold difference, your risk of being hospitalized in this one example, if you didn't have the vaccine. So the take-home message here, more than anything else, is these vaccines are doing what we hoped they would do. They're reducing risk, they're keeping people safe, and they're helping us to get out of this pandemic so that we can all get back to our lives and keep everyone from having the risk to the fullest extent possible of suffering injury, severe illness, or even death from this disease. So folks, there are 3 fantastic vaccines out there right now. Please get the one that's available and please be open to getting it. This is how we keep yourself, your family, your friends, the people you care about safe. And I'm really hoping as we go forward in this, as we expand to more and more vaccine sites, and the governor said there's over 500 already available. The federal government has increased shipments of Pfizer. It's now increased shipments of J&J for next week. It won't happen till later in the week, but it's going to be finally the big increase. There are going to be hundreds of additional vaccine sites over the next couple of weeks that start getting supplied and are available to you to get vaccinated. This is your shot of hope. It's our shot of hope. It's how we get out of this mess that's upended our lives for the last 1 year. Let's please all step forward and get vaccinated so we can move on and put this behind us and get back to the lives that we miss. So thank you very much, Governor, for the chance to talk. I wish us all the best so we get through to the other end as quickly as possible. Thank you.
Thank you to Dr. Stack. Now to today's COVID report. We are reporting 726 new positive cases of COVID-19. That is the smallest Thursday we've had in at least a month. Kentuckians hospitalized are down 35, in the ICU up 3, on a ventilator down 38. Our positivity rate is up 0.07% to 2.92%, still below 3, and we have just 7 red counties. Today we are reporting 19 new deaths, and new deaths, remember, are the ones that come up from the local health departments as opposed to us identifying them through death certificates. Those include a 79-year-old woman from Barron County, and that's a January death, a 71-year-old man from Christian County, a February death, a 67-year-old woman from Clark County, February, a 67-year-old man from Davis County, February, an 88-year-old man from Fayette in February, a 61-year-old man from Gallatin, and a 75-year-old woman from Greenup, both in February, 77-year-old woman from Jackson, a 46-year-old woman from Jefferson, a 68-year-old woman from Jefferson, those are all March, 88-year-old woman, and a 95-year-old man from Jefferson, both February. Kenton County, a 60-year-old man, February, 62-year-old man, March. 90-year-old woman in Marshall County, February. 78-year-old woman in Montgomery, February. 79-year-old man in Taylor, February. 76-year-old man from Washington County, December, and an 84-year-old woman from Woodford County in February. Today, we also have 88 deaths that we are adding from our audit. Now, this pushes us beyond the original 604 we announced because we are being proactive. These are cases that have not come up from the local health departments, I believe, because they're still missing documentation, and they were missing documentation that would be needed to qualify them as a COVID death when we pulled the death certificate and looked at that information. These are ones that are going through our committee process. We're just doing it a little bit faster than it would come up from the local health departments. This will offset ones that we will learn about in the future. So what I think we'll see is, as we're doing this process, more on the front end and a lot less on the back end. For instance, there have been since we started the audit, we believe there's over 100 that came up from the local health department, but we had already found them and reported them through the audit. This means we will get to a full picture of the devastation of this pandemic faster, and we will make sure that there are no unknown losses, that there are no unknown soldiers, and that everybody is counted. Now, let me show you best news of the day. Long-term care facilities. First time, and I don't know how long I've been able to say this to you, we have no new positive cases for residents in long-term care facilities. A year's been a long time, and I can't remember. I can't remember the last day when our update was zero here. I think there may have been a day last week when we weren't doing an update, but just incredible. Only 4 new staff members, 3 new deaths when we go back and work the numbers, but these numbers continue to tick down. Proof, like Dr. Stack talked about, that the vaccines are working. They are our ticket out of this, and they are our ticket to protecting our seniors, being able to go see them in these centers. Really incredible. 0 new cases today in long-term care. All right, with that, let's go over to Amy Cubbage for a UI report, and then we'll open it up to questions.
Thank you, Governor. Just want to remind everyone about the new home screen and login that we launched last Friday. As of Tuesday, we're pleased to announce we had over 24,500 of our claimants able to register and use that new interface. And the new chatbot that's along with that, over 3,000 of you were able to take advantage of that and use it to get information for yourself. And our tutorial videos had 500 views. So please know that those resources, the chatbot and the tutorial, are all out there for you. The new look is, hopefully you're finding more user-friendly and more secure. Just a reminder, once you log in the first time, if you've not had an opportunity to claim benefits yet, make sure that once you hit login, you go down and click here to register. It's about halfway down the page. And it's going to require you to set up a more complex password than you're used to. Make it something you can remember so that you don't have to do a lot of password resets. That new home screen is going to be a lot more modern for you and has commonly used options like your payment request and document upload buttons easily available. Again, the homepage at kcc.ky.gov has information and tutorial videos for you. And this is just one more way we're trying to make sure we keep your information safe and make your user experience a little bit easier. Speaking of keeping information safe and secure, now we've talked a lot about the massive fraud nationwide related to UI claims. We know that so many of you out there are getting letters notifying you that a claim was filed in your name and that you never filed it. U.S. Department of Labor has now launched a new website to help you sort that out because the way these false claims are happening are organized criminals are buying information on the internet from previous data breaches. Just as a reminder, this is not a breach from our UI system. This is pre-existing breaches like you may have seen in the news from past years related to, it could have been Experian, Target, Anthem, lots of breaches that have occurred. That information is bought and sold every day, and that's what scammers are using to file these claims. So once these are filed, they're often filed in multiple states, and U.S. Department of Labor has put together a website that's a sort of one-stop shop that has links to every single state workforce agency and a way for you to report fraud if you do get reports from multiple states. So that is also linked at our kcc.ky.gov website if you need that access. Now, we've spoken over the last couple of weeks about the federal tax break for some UI claimants for the first $10,200 in benefits you drew in 2020. The IRS has announced some good news. If you had already filed your return before that was announced, you do not need to file an amended return at this time. The IRS's current plan is to go ahead and on the back end fix that and issue you a refund of any additional refund or that you may be owed. So you don't need to rush and file an amended return. And that's very good news for all of you who may have already filed your tax returns at the federal level. We're getting a lot of questions related to Senate Bill 7, which allows us now to waive office error overpayments. Those are ones that it was our mistake, not yours. And you may have gotten benefits you weren't entitled to, and now we can waive those. We know you're anxious to get that process underway. Know that once we send out a notice, you will have 30 days under that new law in order to respond. It's not that you have 30 days from passage of that statute. As soon as Office of Unemployment Insurance sends those notices out, we'll give everyone a heads up so you can be looking for it. But for now, sit tight. They're working on it, and you will have the full 30 days in order to request any waiver of that overpayment. We've gotten a few questions about virtual appointments and a few people who have had trouble with those. We have figured out that if you have your cell phone spam filter turned on, you may not receive our call because of the system that we use. So make sure if you've got a virtual appointment, check your settings and make sure the spam filter is turned off. Luckily, last week, there were only 48 people out of our 625 scheduled appointments we couldn't reach. We make every effort to reach out to you, but if you believe you could have that filter turned on, please check your phone. Then finally, a last reminder today about the career centers reopening in mid-April that are going to provide in-person UI services. Those will be in Bowling Green, Covington, Elizabethtown, Hazard, Hopkinsville, Lexington, Louisville, Moorhead, Ashland, Owensboro, Paducah, Prestonsburg, and Somerset. You will have to make appointments, and we will be using the same platform where you make virtual appointments. Watch that kcc.ky.gov website for the launch of that appointment system, and of course, we'll announce it in this weekly update. We are still working out the staffing levels at each one, but the good news is you can also get job assistance, job training assistance, apprenticeship opportunities, vocational rehab, and adult education services, as well as UI services in these comprehensive career centers. So as we get closer to the opening, we will give you more information about how to make those in-person appointments. That's it for today.
Thank you to Amy. Now we'll open it up to questions. We'll start with the Herald leader, Alex Akisto.
Hi, Governor. I have questions on two different topics. The first, so spread of the virus, as we know, has been stemmed significantly across the state, but in some jails and prisons, there are still active outbreaks, as you have announced. The vaccination of some inmates 70 and over began, I believe, last week. Could you talk in more detail about what the vaccination plan is for those inmates and when, for instance, you expect in-person visitations to resume? Secondly, your office gave us a response to this earlier, but I just wanted to follow up with two other questions. Did you approve the firing of the juvenile justice commissioner, and why did the investigation take more than a year? Thanks.
So on jails and prisons, we are still not at the point to announce or schedule in-person visits. As we have seen, the spread can be significant and concerning that occurs in them. The process is underway for any individual in jail that falls, in our prisons that fall in 1B to be vaccinated. Those vaccines have been shipped. We have a plan for the vaccination of the rest of our facilities. We do believe we need to use the Johnson & Johnson vaccine, at least in many of the facilities, because of the length of time we may or may not have people. So we are making plans as we receive significant enough portions to get that done, but that is active and underway. The Personnel Cabinet handled my understanding, the entire investigation and ultimately took action on the juvenile justice head. That authority comes from the head of all of the cabinets, which is Michael Brown. He is over every single cabinet as the top appointed official in Kentucky, certainly has the authority to do that. If there is any concern whatsoever, and there shouldn't be, I filled out the paperwork to make sure that my signature is on providing the Personnel Cabinet Secretary that authority as well. This is why we have a Personnel Cabinet. It's why there are HR departments in so many different businesses. It's because we ought to have professionals that do that work, handle that work. We believe that is the fairest and right way for it to be done. Stu Johnson from WEKU.
Thank you, Governor. Good afternoon. I believe this is probably a question for Dr. Stack. Regarding the transmission of the virus from a vaccinated person, he has talked about this, other health officials have as well. What's the medical science behind that? And have there been cases in Kentucky where that's been, I guess, documented?
Let's go to Dr. Stack.
Thank you, Stu. So I think if I understand what you're saying is what does the medical evidence show about vaccinated people spreading virus to other people? I think I've got that. Let me answer that. And if I misunderstood, if we can just clarify. So we believe, first of all, we know the vaccines protect the people who are vaccinated from having death and severe illness. Not 100%, but pretty doggone close. It's really effective for protecting the person who has been vaccinated from the worst outcomes, death and severe illness resulting in hospitalization in the ICU or mechanical ventilation. The next question is the one I think you've asked, which is if you're vaccinated, one, can you get infected? And if you get infected, can you infect other people? Now, the evidence took longer to get for that, but there is some sign that people who are vaccinated may be less likely to transmit the infection to other people if they get infected themselves. And so that's, I think, why the CDC was able to extend the ability for people to not have to be quarantined if they've been vaccinated, why they felt that it was reasonable to allow for small in-home gatherings if everybody is vaccinated without requiring masks. Now, the science is going to continue to evolve, and it's really going to just take time to see in large populations what actually unfolds. But I want to emphasize again, Stu, it's so important that people get vaccinated as quickly as you can. The longer we have a large number of people who are not vaccinated, the higher the risk that people will get infected and allow the virus the chance to mutate and change and learn how to circumvent or get around these vaccines. So we've got to get people vaccinated as quickly as possible. But for right now, Stu, it appears that people who are vaccinated are probably less likely to infect other people, even if the vaccinated person themselves gets infected. I hope that's answered your question, Governor.
Excuse me. Next, we have Debbie Yetter from the Courier-Journal.
Hey, Governor. I wondered, I'm sure you realize that Governor Holcomb in Indiana has ended the mask mandate effective April 6th. Our question is, do you plan to renew the current mask mandate in Kentucky? And do you foresee a time when you might be able to ease that restriction?
I do plan to re-up and continue the mask mandate, and it's for a couple reasons. First, every single national and state scientist, leader in epidemiology, those that are guiding our country through this, they all agree that we need to continue to wear masks until more people are vaccinated. Second part is I believe that we all have a duty who have been vaccinated to protect those that haven't had the opportunity yet. I mean, give half the people the protection and then stop doing everything we're doing to keep it from spreading. That's wrong for the other portion of people. We've got to make sure we continue to wear them to give enough time for others to get their shot of hope. I do see a future where we won't have a mask mandate. As soon as it's safe, I look forward to lifting it. We are not going to be wearing these forever. But with a future where 200,000 vaccines are coming in a week, which we think is coming up real soon, we're talking about every adult in Kentucky having the opportunity to get vaccinated by the end of May, right? So again, let's not quit early. It is so close. And let's not stop protecting each other until we get to the point where it's safe. Otherwise, we're not providing the same protections for those that are waiting for their vaccine as we did for those that have already gotten it. John Boyle from WFPL.
Hi, Governor. I have a couple for you today. The first one is I wanted to hear your thoughts on why you signed the bills providing tax breaks to the cryptocurrency companies today. And secondly, regarding the GEARS funding, I wanted to hear if the bills that limit your powers within the state by the General Assembly, if that has any impact on this type of funding allocation, as well as any other potential CARES funding that goes to schools.
So the limitations in the budget, which are or will be line item veto, but that they apply to the American Rescue Act. This is CARES Act funding, but a big difference is it is specifically delineated in the statute where it goes and who authorizes how it's spent. That's not the same as much of the Rescue Act dollars that we are talking with leadership on right now. So this is really a piece of that last CARES Act that was actually passed before we were even in session. So it's different. It must be spent in a specific way, and so we believe it's very different. On cryptocurrency, I do not believe the legislation specifically gives a tax break to any one cryptocurrency company. What it allows us to do is to set up a program. It's really an incentive program, much like we have under our KBI program, which is really good, for instance, for manufacturers, and we have other incentive programs for other types of industries. This gives us a chance to sit down, to create the regulations, to then get applications and look at where it makes sense in the Commonwealth for the opportunity. You know, this is certainly an area that appears to be taking off, that may be a huge part of our future, and thus we'd want an opportunity to be competitive in it. But the signing of the bill isn't the end. It now requires the creation of the program. So it'll just be another tool in our toolkit at economic development. But again, to be used judiciously at the right time for the right deal that helps the Commonwealth. Tom Latek from Kentucky Today.
Thank you, Governor, and good afternoon to you, sir.
You too.
I too got the Johnson & Johnson email from some folks, but they also asked a possibly valid question, and that is South Carolina, for example, lists what vaccines are available at the various vaccination sites. Is there any consideration of Kentucky doing the same? And secondly, is there anything new on that Ebola situation that you talked about last week?
So on the Ebola situation, we've now identified 15 travelers total that are in Kentucky that were in either of the two countries that had the outbreak. We have, I think, connected with The vast majority of them, we are still trying to contact the rest, and none of them right now are at high risk. In fact, many of them weren't in or near the area in the country that could put them at risk. So again, we don't have any major level of concern, but this is going on, and we are tracking it. So we are on top of it. The other question, South Carolina, yes. We want people to know as much as possible what vaccine they are getting before they show up to get it. And there are steps that we need to take to make sure that's the case. In most every place, there is both Pfizer and Moderna, and they are very similar vaccines. Certainly our independent pharmacies are going to have a significant portion of the Johnson & Johnson, but we do want to work to try to make sure that people know what vaccines are there when they show up to get them. But we really need people to, as quickly as possible, get whatever vaccine is available. I truly think they're all great vaccines. I get that Johnson & Johnson is only one, but if the other is available right now, you're going to get fully vaccinated by the time you might be able to get Johnson & Johnson. This is vaccinations versus the variant. And if we are too picky individually on which of three great vaccines we get, that helps the variance in that race of vaccine versus variant. John Charlton from WHAS. This one's for Amy.
Yeah, you probably guessed it, Governor. Thank you. I have a couple questions here. You guys talked about the overpayments. Now, we've received several calls and people wondering if they got those notices to pay back the overpayments, and they actually did so. They're wondering what happens next. Could they expect to get that money returned to them? That's one question. And you talked about the fraud, how rampant it is. If somebody had their identification stolen, would that lead to a claim, being locked up because of fraud? And is there a mechanism in place to help those folks? And then the last thing about the regional offices, I guess you're saying you can't come unless you have an appointment. Is there anything set up to prevent long lines, especially that first day it opens?
Yeah, so let me answer the last one, and that's that it's going to be appointment only. So if people show up that don't have an appointment, unfortunately they won't be able to be seen, and they'll be advised on that. We can't have long lines while we're still in COVID, and we want to make sure we get everybody. But we're still going to have in-person appointments, virtual appointments. Hopefully this will pick up the pace. I'll let Amy clarify. I'm not sure we have yet addressed the very first issue that you brought up, but we need to think about that and also look at how the law applies with the overpayment and waiver. We just got that bill passed and signed into law. I'll turn it over to Amy now.
Yes, that's exactly right, Governor. That is part of what the good people over at the Labor Cabinet and the Office of Unemployment Insurance are figuring out in conjunction both with the language of Senate Bill 7 as well as all applicable federal guidance related to waiver of overpayments. So obviously we will attempt to apply it as broadly as we legally can, and we can give updates as we get that figured out. But it's a very valid question. I'm sure it's something that is very concerning to people. So if you have not already paid on your overpayment, sit tight while we figure this out. If you have paid, rest assured we're going to try to figure out how we can best administer this program for the benefit of everyone within the bounds of the law as we have it. Now, with regard to the stolen ID issue, yes, if you have a claim and then someone steals your ID and tries to file, like say, a second claim, that fails ID validation, that will hang up your claim. So that is a good place for, with the new interface, both with the chatbot as well as some of our assistants. I know that's cold comfort for people, since I know that people have trouble other than our virtual appointments, but that is something that will lock up your claim, and that someone on our end will have to go in, get an affidavit about which is the correct claim, which isn't, and clear out any stops on that account so that the claim can still be paid.
And to all of those that haven't made an unemployment claim, but believe their identity has been stolen, to apply for one, what that means is that your information is out there on the dark web or being purchased from one cyber criminal to another. That didn't happen through UI, but what it does mean is you need to take the steps to protect your credit and protect your identity, to make sure that most likely we will not process a claim in your name, but it's being sold in other places and in other ways too. So take those proactive steps. Bruce Maples from Kentucky Health News.
Thank you, Governor. There was a study that came out today from the Christina Lee Brown Biome at the University of Louisville that asked people how likely they were to be vaccinated. And it was encouraging because of the number of people. It was a large majority that said they would. But what I was intrigued with was that they broke it out by demographics and by area. And so I'm wondering if the state, as you track vaccines, if you are also gathering demographic data and geographic data, and if in fact you could produce a map showing counties' vaccination rates and vaccination rates by demographics.
That's a good question. Right now, I know we have overall demographics in terms of age and gender and race. Demographics by county is something that we'll have to look at. I do believe in the near future we're going to be able to finally be able to produce positivity rates by county. That's something that we've been working on for a while, and we hope to be able to unveil here soon. But we'll check on that. It'll require that, obviously we're able to track individuals who go to a facility outside of their county back to it. But we'll check in on that. We will see what we can do. Now, obviously, we got the same number of people who work on data. And oftentimes we add something and we add something and we add something, hospital capacity, adding an extra column here. And so what it may mean is for a piece of information that's no longer as interesting to the media or others, we may have to swap one piece out for the other, but let us take a look at that. All right, everybody, we will be back on Monday, but remember, we are not out of the woods yet. Keep wearing a mask. If you're going on spring break, be careful. Make sure that you act wherever you are going in the way that you would act here. Make sure you wear that mask when you're around other people. And everybody, get vaccinated as quickly as you can. Take whichever vaccine is out there. I think we got a chance, and I think we got a good chance to beat this thing and to finally defeat COVID-19 and to do it before these variants can catch up to us. But that's going to require that we keep up the pace that we have. I mean, we are going to win. We just need everybody to be ready when their time for their vaccine comes to go get it. All right, we'll see you Monday at 4 p.m.